Good evening here in Kuala Lumpur, and good morning to people in Dublin. And I believe we've got people joining this meeting from various colleges and institutions around the world, really. And from Malaysia, we've got students from IMU, from Perdana, Masa, Newcastle, and Pest, to mention a few. And I'm also told that we've got some students from some of the European countries. So welcome everybody to this session. And this is really an information giving session on the Masters in Surgical Science and Practice program in Dublin. So before we kick off, let me just go through how we're going to do this. So we've got this welcome address, after which Dr. Marie Morris is going to address us about the program itself, and then we have a session on student experience, where Dr. Primpreet Man, who was a student here in Perdana University in Malaysia, he's going to tell us his personal experience in Dublin and about the program. And after which we'll take some questions. Now we've had some questions already. I'm sure we'll have more questions in the chat box, and we'll try to answer as many questions as possible. So that's how we've structured this. So if there's any issues, any questions at all, please feel free to put that in the chat box. Okay. So now I'd like to introduce our speaker for this evening. Now, Dr. Marie Morris is a healthcare educator, and she's had 30 years experience in healthcare and healthcare education. Now, she started off as a critical care nurse, 20 years, practiced as a critical care nurse in the UK, and after which she continued her studies in the School of Medicine in Trinity College, Dublin. And she got a PhD in surgical education and an MSc in clinical medicine and a postgrad diploma in higher education, which is fantastic. So her teaching has a strong interdisciplinary component, and students learn about other disciplines as well, and therefore they're able to, or their aim is to deliver a holistic, patient-centered care. And Dr. Morris's unique and innovative approach to education has been recognized locally as well as nationally and internationally, and she's a recipient of several awards. The Trinity College Dublin Provost Award for Teaching Excellence, and the National Teaching and Learning Forum's National Teaching Hero Award. And she's also been awarded the Trinity College Dublin's Dean's Award for Innovation in Teaching and Assessment for 3 consecutive years. And she's also in receipt of the RCSI's Award for Education, Innovation, and the Student Champion Award. And as I think one of the best awards you can get is from your own students. Now, her work also includes 25 peer-reviewed publications and numerous conference presentations. And nationally, she's the Deputy National Representative for the European Association of Communication Skills in Healthcare. And internationally, she's the Head of Assessment for the Fellowship of the European Board of Surgery Examinations. So with that, may I welcome you, Dr. Marie Morris, and can I request you to address all of us? Thank you.
Wonderful. Thank you so much, Professor Raiku. Delighted to be here. And I will just share my slides just now. So good evening, everybody. Delighted to join you here from an unusually sunny Dublin, which is great. So you're all very, very welcome. And myself and Prim, one of our current MSSP scholars, are delighted to talk to you about the MSSP programme that we run here in Dublin, and we'll be starting year 4 in September this year. So we're delighted that the programme has taken off. It's the vision of Professor Oscar Traynor. So Professor Traynor seen probably 4 or 5 years ago that the old apprenticeship model of training to time would have to change, just because of the healthcare provision needed, obviously, by consultants. The actual daily job became so much busier, and the number of students became greater, that the apprenticeship model wasn't going to continue. So the move towards sort of proven competency and training related to your own competency rather than time was the future, which Professor Traynor had the vision to see, and he presented this work at a conference which completely caught my attention and interest because it's sort of fed into the area that I've always been interested in within medical education. I've always felt that the undergraduate medical degree obviously teaches knowledge exceptionally well. You finish with a brilliant brain full of medical knowledge, but the missing piece is the joining the dots of actually how to be a doctor. How do you take all this knowledge and all these skills that you learn in a very safe environment in skills labs and in settings, and actually do the job at 2 o'clock in the morning when you have a patient that's unstable. So that's always been my area of interest, which is why I went back and did further training to try and ease that transition from final medical year student into actual hospital doctor. So that's where the MSSP sort of comes in, and that's where it fits within your sort of trajectory of your surgical training. And you'll see and hear once you speak to Prim later as well, it's more than just a medical or a academic master's program. It really is a full experience, the MSSP, because it's full time and you spend 8 or 9 hours a day, 5 days a week, 40 weeks of the year together. Lifelong friendships are made on this program, and it's a full experience. We have like travel clubs set up where the students are touring around Ireland. We're still in touch with year 1 and year 2 students, so we keep in touch. We follow to see how they're going. We put them in touch with consultants in their own countries for networking, help them with research. One of our students is coming back to do an MD with us now. So it really is an experience rather than just an isolated program. So you can do the program straight out of medical school. There's no need to have done an internship. If you have done an internship, you can also do the program. What we found from the feedback from previous students is those who came straight from medical school really found it very, very helpful when they went into their internship. They could hit the ground running because they had all the skills, technical and non-technical and clinical skills required to do the job. And we've had some really good feedback from consultants in and around the Dublin hospitals on how well equipped the interns, the graduates, the scholars of the MSSP are when they actually hit surgical ward intern posts. And the whole point of the program is, that you enter your clinical training, your surgical training at a more advanced level with provable competencies. So the whole program currently runs in number 26 York Street here in Dublin, which is a purpose-built unit. It's absolutely superb simulation, one of the biggest simulation suites in Europe. So the whole top 3 floors, what we do in essence is create a virtual hospital. The whole point of the program is that we sort of create the hospital job and put you through all of the activities you would do in a job, so that you're able to do the job when you go there, so that you learn in a really integrated fashion. So the top floor, the 5th floor, is completely wet enabled space where you'll do all your technical skills, biological, animal models, synthetics. The 4th floor consists of inpatient rooms, single and double inpatient rooms, so we can run our simulated ward rounds. And then the 3rd floor is simulated outpatient clinic rooms. So it really is a fit for purpose building, which is absolutely fantastic resources to learn in and to get you into the mindset of doing the job. We also get you to, as soon as you come into the building, to change into scrubs so that you're getting the identity of a surgical trainee, so that when you come in, that it's not, even if you're in the classroom short term, that you're in the mindset that you are a surgical trainee and that you're training to be a surgeon, so that you're dressed like a surgeon and you turn up into the activities that a surgical team would do. So, absolutely state-of-the-art facilities, overhead lighting, everything that you would have in a theatre setup, whether it's desktop, benchtop models or fully full operative procedures. So it's exactly set up as a hospital would be, which gives it that fidelity and reality that you want, so that it feels real. And sometimes you can get so lost in the simulations that, it does actually feel very, very real. And then we have on the 4th floor a mock operating room, which is also a mock emergency room. So we can run through all the scenarios that you would come across for if you were asked as a surgical SHO to come down and see a surgical patient in the emergency room, and the full team would be there with you. You'll have your nurses, you'd have the emergency doctors if it's anaesthetic related and you needed airway help, and assistants. The anaesthetic team would be there. So again, the whole thing is set up and it's observed remotely so that your peers can give feedback and faculty can debrief. So it makes the fidelity and the reality very, very real. And it brings the emotion into it because it creates the stress of the alarms going off and the urgency of the case, which is really, really important, because it's the emotional component that's often missing in skills training, and that's the part that can paralyze you sometimes clinically when you have to manage a situation that's stressful. So you go through these simulated settings in a very psychologically safe environment so that you've already met the conditions and the presentations within the MSSP, so that when you meet patients clinically presenting, you've already met this scenario and dealt with the scenario and been debriefed and had an opportunity to practice it again. So it helps you sort of develop your own repertoire of skills and knowledge. We have a fantastic tech team that support us, a group of technicians, that really do some excellent moulage, as you'll see here, some really good burn scenarios, some lacerations, and so we can really use really good realistic moulage as well to make it look as realistic as possible within a simulated setting, which I think is really, really important also. So yeah, so one of the things that I'm absolutely passionate about is that, that this program is very much about doing, that you do the job. There's often, a sort of emphasis on saying what you would do. I would put in a cannula, or I would put in a catheter, or I would do this, or I would do that. So with this program, there's sort of no would or should. You do it, like in real time, you do. So the two of the modules are knowledge based, but we do like a flipped classroom where you get the information in advance and then have the discussion with the experts about the topics. And then all of the other modules, which we'll look at shortly, are skills based. So you actually do them. So we really do not want to have a lot of PowerPoint presentations in this program, because it's not knowledge. There's a knowledge underpinning, but it's experiential. You're doing it and learning from doing it, so that you're ready to actually do the job. So that's really important. I'm not a fan of PowerPoints. And again, you'll often hear people say, practice makes perfect. You just keep practicing and practicing and practicing. But there is a caveat with that, which I think is really, really important. And any of you that have done driving lessons with family or friends, informally, you can see that you can practice, but you can be practicing badly and wrongly and setting up neural pathways in your brain that are actually wrong. And then it's really difficult to unlearn the wrong practice in order to get it right. So within the MSSP, we're, all faculty absolutely believe that, it's perfect practice that makes perfect. So you must be supervised. You must be supervised by experts. You must have a high faculty to student ratio so that you're getting feedback from experts who are working clinically. So you get exposure to a lot of clinical experts in general surgery and subspecialist surgery, which also helps you network. So you can, link in with these consultants in practice, either to do your research with them, to maybe do an observership, or to work with them in the future. So you get really good access to, and a lot of one-to-one with experts in the field. So any practice that you do is generally supervised until you're absolutely sure that you're competent. And once you're competent, once you've been assessed and we know you're absolutely competent, then you can practice unsupervised. But all of the skills initially are supervised practice, because we want to make sure that you're learning it correctly, which is really important. Lots of educational paradigms underpinning the MSSP. So as we said to you, you learn by doing. So you're in high fidelity simulation. So we recreate the whole environment of an operating room or an emergency room or a ward round, with the noises and the interruptions and the distractions and the alarms and all the things that create the stress, the background stresses that you're going to have to deal with and manage clinically. So that's really important. You're constantly reflecting. So your ward rounds, you're given feedback informally in every class. You have all your classes videoed, so you can go back and look at your videos. You get feedback from simulated patients, from actors, from your peers, from faculty, so you can keep all that information. Like I say, it's deliberate, repeated practice, so that you really embed your skill set and that you practice them supervised, so that you're doing it well and expertly, which is really, really important. It's also really important that you move, and this is a bit of a paradigm shift as well from undergrads. We tend to learn a lot of the knowledge-based skills with mass learning or cramming. You sort of, you might study for 5 hours a day for 5 days of a week. and then get past the exam because it's in your short-term memory. So we do distributed learning. So again, back to your sort of driving lessons, if you did one lesson a day for 10 days and then did your test, you might well pass because it's in your short-term memory. But if we put you out in a car in 3 months' time, you probably wouldn't be able to drive safely. So the benefit of distributed learning is that you repeat it continuously. You would do it once a week, 1 hour a week, every week for 10 weeks. So that you're constantly reinforcing your learning. And we know from memory that your memory is greater and you forget less if you do if your learning is distributed. And then the other thing that's really, really important is learning is a social event. And so you learn with your peers, from your peers, you learn by working and construct your knowledge by working with physios and pharmacists and nurses and other disciplines who see healthcare through a different lens. So you get to see other perspectives that also support your learning. So there's a lot of really good research underpinning the actual program. Now, the other thing that's really novel and innovative is most of you that have studied before, or if any of you have done masters or postgrads courses, the modules are generally delivered in little blocks. So you do module 1, you learn it all off, you do your assessments, you forget it, you move on to module 2, then you move, so they're all standalone little blocks of information. So the MSSP is absolutely different insofar as you have all the modules running concurrently across a week, so that your knowledge is reinforced continuously across all of the modules, across each week, across each semester, and across each year, the same as a job. So you're going to have to use your knowledge, your clinical skills, your technical skills, your non-tech skills, and act as a professional every day in your job as a surgical trainee. And so that's how we deliver the program. So we integrate it and deliver it as you would work in the post rather than have these standalone modules. So module 1, which is core knowledge, clinical judgment, that's consists of a boot camp on basic anatomy, physiology, surgical pathology, so that you have your basic sciences for your MRCS Part A. So we cover the whole, so the England, Ireland, Scotland, Wales, the 4 colleges, but the Royal College of Surgeons have a curriculum, a core curriculum for surgical training, which takes 2 years to do alongside a post. What we do in the MSSP is deliver that full curriculum in 1 year, and we also deliver the entire curriculum for the MRCS exam, Part A and B. So they're both covered. You'll meet Mr. Dara Kavanagh is the module lead for that program. At the practical side is that you do surgical forums, grand rounds, case-based discussions, journal clubs, simulated MDT meetings, so that you're able to discuss particular case management across a number of forums to, again, as you would in a hospital setting. So we're always trying to emulate what you would do on the job in the hospital setting. Module 2, which is clinical skills. So again, it's very much about every week we run a teaching ward round so that you get the opportunity to review patients. There could be new admissions. There could be routine post-op patients. There can be post-op patients that have had complications. There can be patients that have come back from HDU or ICU that have been stepped down and you need to manage them. Same with outpatient clinics. You review outpatients in the outpatient clinic. And we liaise with consultant anesthesiologists to run pre-optimization clinics to look at the medical management of surgical patients to ensure they're safe for surgery. We have an intensivist that will run through the critically ill surgical patient and what your role would be if you were going as the SHO with your team to review that patient in the ICU. Lots of emergency room, acute presentations. And then the simulated nights on call are quite unique as well. And it's really, again, that sort of joining the dots and delivering what's not delivered generally in training is sort of time management, prioritization. You have your list of patients. Who do you go to first? And having a thought process about why you go to that patient first. When do you escalate? When do you call your consultant? Do you call your consultant or registrar? What's the criteria? If you do call, how do you have that conversation? Writing up all your medical records, writing your notes, referring patients on to other disciplines, discharge letters, all that sort of stuff that you're required to do in the job that's often not taught. So we run them every single week. We also bring in real patients from the local Dublin hospitals so that you actually do get to see patients with surgical clinical signs of scars from surgery or stomas or AV fistulas for dialysis or post-transplant hernias, so that you're actually getting to examine and have real clinical findings. So we also rotate and include that. Really important as well that you work with other disciplines, because obviously no discipline works in isolation. So you get to work with nurses, physios and pharmacists on the ward round and have discussions. It also gives you insight into what exactly their roles are within the healthcare team. And it makes it easier for you then to be proactive and refer patients on for physio earlier, preventatively, rather than wait until the patient already, say, has a post-op chest infection and then it's sort of reactive. So it gives you a really good insight into what the other disciplines' roles are, which is really important, because often that's not taught. As you might have an idea, but you won't be sure exactly. So the ward round includes all those people, and we generally do it with sort of 2 teams. So team A go in and take the history, do the exam, look for any of the data, look for all the radiology, come up with a management plan, and then present that management plan to the consultant on the team, and then discuss the treatment with the patient. While that's going on, team B get the handover sheet. They get to see all the different patients. They decide who they're going to see first and why, and get all the paperwork ready. And one person observes the whole procedure, the whole ward round from start to finish, and fills in the General Medical Council's professional capability to see how the team actually ran the ward round and how many of the competencies did they manage to include in the ward round. And then that's fed back and mapped as a sort of audit as well, which is really good. And what's really important here is it's a teaching round. So, there's about 30 minutes, sometimes 40, spent discussing the case, so that you get the opportunity to have a huge discussion about the presentation and management of the case, which again, clinically, with the pressure of service, the teaching component of the ward round is often lost. So there's plenty of time to ask questions and to review. Module 3 then is a double module. It's a 30 credit module, which is run by Miss Leonie Heskin, who is a plastic surgeon. And like I said, that covers the whole of the intercollegiate core surgical curriculum, a 2-year curriculum in 1 year. Again, in state-of-the-art facilities, and it covers general surgery and a lot of the subspecialist, including all the laparoscopic, augmented reality, and every technology that's available, because it's such a purpose-built unit, which is absolutely superb. And then Angela O'D currently runs our non-technical skills, our human factors. And you'll see from error generally, it's very, very, very rare that a surgeon makes a technical error. The technical skills training is superb to expert level. It's generally a breakdown in communication when things go wrong. So all the teamwork, all the interdisciplinary work, patient interactions, managing emotional patients. What if the patient gets really angry? What if the patient gets really sad? What if the patient just goes silent? When you break bad news, it's learning to manage the emotion of that situation. Obviously, the whole safety aspect of surgery, interacting with others within your own team and other teams. If there's conflict, if you're getting pushback, you're trying to refer a patient for an investigation or for another opinion, and you're getting pushback. How do you manage? What if you want a day off to do the MRCS exam, but you're scheduled to work? How do you negotiate that? So all those skills, those communication skills, those challenging skills that you're required in the job, which again aren't often taught, they're all covered as part of module 4. And then module 5 is a nice little module of it gives you insight into other roles that you'll be required to do within a clinical setting, with regards to the economics and budgets and healthcare management, obviously patient safety, information technology, any innovations within surgery, global surgery, professional behavior. So it gives you insight into all the other things that your clinical role would have, that again, you're not formally taught, but would become part of your role as you progress through your career. So this just gives you an idea of what your week is like. So as I mentioned earlier, it's a busy week. It's a full-time program. As I said, we're trying to emulate the job. So we want you to be busy all the time. So Prem will be able to give you some insight there as to how busy it is, but it is generally a busy program. You have a morning. So this coming year 4 of the program, we're scaling the program up to 24 students. So to keep the numbers small and to keep the high faculty ratio to student, we'll have two teams. So one team A will in the morning on a Monday do their surgical pathology or organ system physiology, while team B do technical skills, and then you'd swap in the afternoon. Tuesday morning is non-tech skills. That's where you're doing your communication skills with either trained professional actors and practicing getting consent, breaking bad news, disclosing an error, like I said, negotiation skills. Tuesday afternoon, then you'll do your case-based discussions or surgical forum. They alternate. Wednesday morning, half of you would come and do the ward round while the other half do technical skills, and then you'd swap so that you're all getting the same experience. Then you link in to grand rounds in Beaumont, Dublin Hospital, and attend grand rounds, and then Professor Trainer does a grand rounds extra, addressing any questions with regards to those cases. Then you have your module 5, so that all those little sub-modules, which are very much for information, are on a Thursday mid-morning, and then on Thursday afternoons you alternate between multidisciplinary team meeting, so you'd have 4 to 5 consultants come in and discuss the management of a case and or your journal club. And then we try to keep Fridays relatively free. So Friday mornings we do a catch up just to see if there's any queries. You ask the students to do an evaluation. The program is completely adapted to each group. So we also have that time on a Friday morning. Say, for example, students have identified that the MRCS exam is coming up and they wish to further practice blood cultures and urinary catheter and NG tube. So we would then use that Friday morning to do those skills. So if there's anything, the students identify something within the program that they'd like more of, we then can add it into that session on the Friday. So the program is always evolving to meet the group and to meet the students' needs, which I think is great. And then we try to protect the study time on a Friday afternoon because there are continuous assessments as well. So we try to give some downtime, within the program. But obviously the whole point is to keep it busy. So it completely replicates a clinical post. So the assessments, again, obviously we can give you this in more detail, but just to give you an idea. So all higher institutes in Ireland's pass mark is 50%. So the pass mark is 50%, and you can compensate across modules, as in if you get between 45 and 49 in some modules, you can compensate across the modules except for surgical technical skills. Because it's a master's in surgical science and practice, it's obviously very important that you can do basic surgical and technical skills. So you must pass surgical technical skills and you must pass your research project in order to achieve the MCH, the master's. There is obviously supplemental exams. So we do supplemental exams for each assessment that we do. So you would get a second chance to supplement. But it's in order to achieve the MCH, you do need to pass surgical technical skills module 3 and the research project. So the assessments continues. You're constantly getting feedback in all of the modules. You've been observed by expert faculty. You're being given feedback so that you can continue to learn. The high stakes exams I'll show you just now are, we titrate them across the year so that you're not getting too many assessments at any one time, but there is assessments continuously. And then you're continuously being given feedback by your peers as well. So you tend to work in groups so that your peer can give you feedback on your performance as well, which is really good because you learn as well from assessing your peers. So if you have the checklists and you can assess your peers, you can then see what the criteria is to actually pass that particular assessment. And you have access to a sort of e-portfolio. All of your classes, your ward rounds, assessments are all video recorded. You can add in the comments from your simulated patients and from your actors and from your peers and faculty, give you feedback on those videos. So you can go back and watch your videos and see how you're progressing yourself, which is really, really, really helpful. And it's really good to do in the latter parts of the program to compare how you were at the beginning. So that looks busy, but it just gives you an idea that, you generally have 1 or 2 assessments every month, and we spread them across the whole year. So there's nothing too onerous at any one time. Another example of how we sort of mold the program to suit the group. Often, if people have come straight from undergraduate medicine, they may not have written a lot of academic essays. And sometimes English isn't first language either, so writing academically can be a complete new skill set. So that was the feedback this year from a couple of the students. So I worked with an educational technologist, and we've actually written a module now to help people write academic essays and to get feedback on their writing. And you'll see that we put in small assignments, say in module 2, written assignment is just like a 500-word essay, so that you write 500 words, then you write 1,000 words, then you write 2,000 words as the year progresses. So by the time you get to the end to write 3,000 words, it's not such a big task because you've already done 3 or 4 smaller essays and you've got feedback on all of the essays. And we do a nice mixture of case-based discussions with practical exams, with oral presentations, with case studies, so that you're getting a nice array of different types of assessment as well. And then just really some of the questions that often come up. So because it's a taught program, you're not required to do a full thesis. So you don't need to do a 10,000 words piece of primary research. You don't need to do a primary research project. And obviously you're not based in a hospital, so you don't have access to patients to do primary research. So your options are a research proposal or a research a scoping review of the literature. So the research proposal is planning something you might do in the future. So if you do wish to return and work with consultants that you've worked with previously, you might plan a research project, review the literature, describe the methodology you're going to do, how you're going to analyze your data, and then you can use that as towards ethics application or towards a grant application, or you can do a review of the literature to identify a gap in an area that you're interested in. But you don't have to do a 10,000 word thesis. So just to reassure you there, it's a much smaller project. So that is my sort of overview for you all, everybody. I hope that has answered a lot of your questions. And if not, once we get to the question and answer session, we'll be delighted to answer any questions that you might have. And I look forward to hopefully welcoming some of you to Dublin in September.
Fantastic. Yeah, thank you very much, Dr. Morris. I think, when I was training, we were just, after internship, we were just pushed into a surgical ward and we were kind of beaten into shape, if you like. But things have changed so much, isn't that right? I mean, now you know that is simply not acceptable, and here is an opportunity for people to get into a controlled environment, learn things properly the way they should be learned. And I think students should take this opportunity. Especially if you're going to pursue surgery, you have to take this opportunity. In fact, I just wonder, this probably will become mandatory at some stage, wouldn't it?
Yeah, I suspect, and I think the two aspects, it's safer for the patient, obviously, because by the time you go into practice as a doctor, but it's
Yeah.
also safer for you as a doctor, because you learn about yourself, you learn where your stressors are, you learn to manage yourself, your time, your sleep, your diet, so that you don't burn out later because you've actually been exposed to the reality of the job. And we have had a couple of students in previous years that decided they don't want to do surgery at all at the end of this program. They went into emergency medicine or anesthesiology, and I still think that's a good outcome because it means they've chosen the right path earlier. Because it's very difficult once you get into an 8-year program to get out. So it gives you insight into yourself and where your strengths are and any limitations you might have, and a really good overview of what the actual job is that you're signing up for.
That's absolutely true. Absolutely true. I almost feel like doing this myself. Actually, not a bad, not a bad idea. I mean, perhaps train the trainer sort of thing. We'll
Yeah.
tend to live on our own environment and do the same thing again and again. Once in a while, I think a critical review of our own practice, is not a bad thing. Anyway, that's fantastic. Thank you very much for that. And so let's take some questions, shall we? I mean, we've got some questions that have already come in to us by email. And there's a couple of questions there in the chat box. Maybe I can just start off by asking you, Dr. Morris. I mean, do you need any experience at all in surgery before starting this course, or what do you think?
No, not necessarily. I mean, interestingly, in year 1, quite a few students had done their internship. And then in year 2, most hadn't. And the feedback from the previous sort of alumni now has been that it really helps them to do the intern job. They actually could do the intern job straight up. So no, the requirement is basically that an honours or a medical degree, that you've done a medical degree in a WHO approved medical institution, and that you have English language proficiency to an IELTS of a 6.5. That's it. So you don't need any experience at all apart from that.
Right. Okay. And in fact, that's probably an advantage if you ask me, because you start learning things the right way,
Yeah.
pretty much straight away.
Yeah.
Okay, fantastic. Yeah. And is there an exam after every module? If yes, what's the exam format? I think you've answered that question.
Yeah,
I
no,
think
the
you do
exam,
have,
yeah, they're
yeah.
continuous. We don't wait till the end of the module because all modules run continuously across the whole year. So there's assessments every single month. It might be a case-based discussion. It might be a small OSCE. So there's at least 2 or 3 assessments going on every month across the whole year. There's no big end of year exam. You've done it all incrementally across the whole program.
Right. Okay. And let's see. I'm just going through the chat box. I think there's a couple there. Um, I think that might be for you as well, Dr. Morris. In the application, fourth question is write a brief statement on research interests and experience to date. For example, quantum neuropsychopathology. So I'm not sure what the question there is. Are you asking Dr. Patel whether or not any research background is required? Is that your question? And is any research background required at all?
No, absolutely. Again, we start as an absolute introduction to research and research methodology. So we take it that people have done no research when they join the program. And obviously for those who have done some, we'd work with them and maybe push them a bit at a more advanced level. And we would we appreciate people take a year out of clinical practice, and there's always that balance. So at interview, we would always discuss with each student. We almost do the reason we do the interviews rather than just a straightforward application is that we do an element of career advice, really. So we look to see what is the best thing for that particular student to do. Are they better off doing an internship? Are they better off considering taking the year out and doing the MSSP? Or are they better off doing, if they have a family and financial commitments, maybe it's best to do the MCH part-time and do a job. But if you're going to take the year out, I would say, be clever about it. Take a year out, do the MSSP, knuckle down and study and do your MRCS exam as well. And if you have any research experience, then consider writing a really good scoping review of the literature and get it published. I mean, some of our students have done all 3 in the year, which is a really good use of a year. And if you had to defend on a CV, why have you got a gap? It would be a very productive gap if you did all 3 in a year.
But Pranpreet was one of our students at Perdana University, and a very good one at that. And I'm glad to see that our students. I mean, we've had a few who've gone for the program, and they've all done very well. And I'm so happy to see them all do so well internationally at such an early stage. So over to you, Pranpreet.
Hi, thanks for the introduction, Prof. Raghu. Can everyone hear me okay? I'm not sure if my mic is working all right.
Yes, we can hear you. We can hear you.
Okay.
Maybe you might want to speak a little louder. That's all. Thank you.
Okay. So, yeah, like Prof. Raghu said, I was one of the students in PU RCSI, and I completed my undergrad medical degree, and then I joined this program immediately after. And unfortunately, I don't have any slides for you guys today, so you're just gonna have to look at my face. What I'm going to talk about today is actually, I'm just going to talk briefly about the program, but I do think that a presentation like this, it will not do the program justice, I would say, because when I joined this program, it went above and beyond what I expected from it. And if you decide to join this program, I'm sure you'll come to the same conclusion as well. So I'm going to talk a little bit about what Dr. Marie has already touched on, but I'm going to give a student's perspective on it. So, like Dr. Marie said, there's 5 modules to the program. So one of which is core knowledge, right? And I think for students that are just coming out of the undergraduate medical degree, it's very beneficial to join this program because you will have a fresh memory and a very good foundation to start learning from this program. But it's not the same as your undergraduate degree in the sense that when you're in this program, the way you learn is a very practical sort of approach. So, for example, you're seeing many patients and you're dealing with many patients in a stipulated amount of time, and you're going about it in a practical approach where you're learning how to, talk to your superiors, use ISPAR, like integrate all of these different things you've learned in medical school in a very practical sense rather than, taking a 15-minute history, like a full history for someone who's presenting with some kind of post-op disease. So it's a very practical approach, and that was something I had to adapt with over time, although I had good foundation in medical school. But I think the true value of this program comes from the way the simulation is done. So when it comes to the technical skills, the fidelity to the simulation is absolutely mind-boggling. Like, you learn everything from basic suturing all the way up to very advanced surgical skills like flagellate heart repair, tendon repair. You do interventional radiology, and it all goes from different subspecialties. So you start like from a general surgery approach. So you're doing things in the abdomen like primary bowel anastomosis, side to side bowel anastomosis, and then you're moving all the way up to cardiothoracics, ENT, urology, things like that. So that kind of simulation you're not going to get anywhere else, because you see, when most surgical trainees are training, they're training in the hospital, and that's most likely the first time they're doing whatever surgical skill they're practicing is they're doing it for the first time. Whereas here in a simulated setting, you're getting one-to-one feedback most of the time, and you're perfecting those individual skills every time you do it. So by the time you move into an internship setting, you'll probably have perfected those skills. So like Dr. Marie said, like, it's not just practice, it's perfect practice. So that's one aspect that I think this program has completely nailed down, is the fidelity of the simulation. The other thing is, when it comes to non-technical skills like communication skills, I think this program is very well suited for that as well, because on a weekly basis we're practicing these communication skills. So, and we're not practicing it in an isolated setting per se. We're integrating it into our clinical work and adding it on to our clinical acumen. So like when we're seeing patients and taking histories and doing physical exams, we're integrating things like ISBAR and things like information giving, gathering, breaking bad news, all in a stretch while you're in that on-call setting or in that work setting. So that's very different from how you do things in undergrad. Like, for example, in undergrad PU RCSI, where we followed the RCSI syllabus, we did it in a very isolated sort of setting. So when we were doing OSCEs, we're just doing it for communication skills. This helps you integrate that. And I think it comes with a lot of practice, and over time, you will be able to hone those communication skills as well from this program. And then the last thing I want to touch on is about from the research aspect. So I know a lot of you probably don't have a lot of experience in research, and that's completely fine. I would say, because the program itself, it ramps you up gradually. So you start off from a very basic sort of perspective of like what research is, how research is performed, and you build up from there. So by the end of the program, you'll be very proficient at writing, finding out what sort of research questions you want to ask, how to write those research papers and stuff like that. So you're not just jumping straight into it, doing a research report from the beginning. You're starting with simple things like writing essays, moving on to literature reviews, and then moving on to something more advanced like a systematic review or a meta-analysis. So those that is something I don't want anyone to be intimidated by, because when I was joining the program, and I was a little bit intimidated by the research aspect of it. So I mean, it's true to be said for all aspects of the program. It's all gradual, and it suits every student's needs. There's some students who maybe years off of their clinical skills, they've taken a break or they've been doing internship for a while. There's some students straight out of med school. Attention is given to all students, and everyone will be at the same level by the end of the program. So that's in terms of the program. So the other side I like to speak a little bit about is about the experience you will have in Ireland. So it can be very daunting for most students. You know, they're coming to Ireland for the first time, they're leaving home for the first time, which was the case for me, and that can be very daunting. I left on, as Prof. Raghu will say, like we didn't know when our program was going to end because of COVID, so we left on a very last minute kind of thing, a very last minute kind of preparation. But like when I arrived here, like I couldn't be more grateful to Dr. Marie and Prof. Trainer, who really helped me assimilate into Ireland and also into the RCSI MCH MSSP program. They helped me a lot, and they were, and the people here I would say are very friendly. So it's a good opportunity to make friends, to network. So those two aspects I think are very important and can't be understated. So like when you're interacting with some of the professors and some of the colleagues in the surgical field and stuff like that, like you're working with core surgical trainees, so you're building networks as well, you're building connections as well, you're building like even your colleagues itself, like from your course, the friendships that will last a lifetime. And these networking skills, I think is something that's a great aspect of this program as well. And not just that, like you're living in a student accommodation, so you're making a lot of friends, like in your accommodation itself. You're in the RCSI campus, so you're meeting a lot of students from undergrad and stuff like that. You're able to join a lot of the activities, like and see Ireland and stuff like that. So it does definitely a good balance in terms of the program itself as well as extracurricular like activities, like meeting people, having fun, stuff like that. So it's not all work; it's work and play as well. So it's an experience, I would say. And I think if you're joining this program, it's a good opportunity for you to take additional exams. So do your MRCS while you're in the program if you can, because the program is very suited for the MRCS syllabus. So you'll find it very beneficial to do the MCH and the MRCS at the same time, and it's quite feasible because like Dr. Marie and Prof. Trainer, they're very open to feedback and they're very accommodating as well. So if you need some time off for sit for your MRCSA, they will arrange the program around that. They won't put too many exams around that time and stuff like that. They will definitely help you with the program with the MRCS and stuff like that. So take it as a 1 year commitment to your education, and it'll be fruitful in the long run. You could possibly finish your part A and part B at the same time and get your registration and stuff like that. So I think that's about all I have to say. I'm definitely open to any questions you might have. Like I can give you a student's perspective of the program, but if there are no questions, like I'll pass it on to I guess Tevin and Rebecca to answer any questions that have been sent to the chat. But yeah, that's all from me. Thanks so much, guys.
That's great, Prampreet. That's so good to hear. I mean, I totally agree. I think you have integrated very well, and from what I understand, you're doing very well. So congratulations. I think yes. To continue with our questions, I'm once again. I did. Sorry, I broke protocol, and now you answered a few. We went through a few of those questions. So now we've got a couple more here in the chat box, and there's a question here about. I think there's some people who have some disabilities, and I think will that be a problem going up and downstairs? Is that perhaps Marie you can answer the question? You've got facilities for people
Yeah,
who have some physical disabilities, perhaps.
absolutely. Yeah, I mean, number 26 York Street is superbly modern building that's been purpose built. So there's lifts, there's wheelchair access bathrooms on every floor, huge
Mm-hmm.
big wide corridors and everything. So no, that would most definitely wouldn't be a limitation in any way, shape, or form. And we meet every student as Prim has said, and we work with
Mm-hmm.
every student to ensure they get the best out of the program individually. So we, if somebody, when they apply, when we interview, we discuss all that and make sure that we have the plans in place to make it the best experience for that student.
That's great. Thank you. There's another question here on IELTS waiver in the chat box. Now, I'm sure there are certain rules regarding that. Uh, Any more information on that? There's a specific question on an English-speaking country.
Yeah, best thing really would be to put that into the chat, and we'll talk to Paula and look at it. So we'd look at in each individual case. If they have a qualification that's of equal standard, we could have a look, or they could take an English proficiency test. But obviously the whole program is delivered in English, so they'd have to have verbal and written English to a set standard. So if it's not necessarily the IELTS, we'll have a look individually just to see at what standards the individual student is at, to make sure that they're okay to actually write the written side of the program. So contact mssp.ie if that student would, please, and then we'll follow up with you individually to see like where, you know, is their qualification equal, or do they need to do anything extra?
Okay, thank you. Now, Prinpreet, I think the next couple of questions are for you. What is your advice about filling in the application form, personal statements, and how is the interview? Any advice on someone who's applying for this course? What should the main focus be, perhaps in the personal statement?
Okay, thanks, Prof. Raghu. I mean, I would say that when you're writing your personal statement, just keep it succinct and write about your passion for surgery, because at the end of the day, it is a surgical course. So what I did was I wrote about my interest in surgery and what kind of specialty that I was looking into. So that's, I mean, as long as you write something along those lines, it should be okay. I'm not the one that's assessing the personal statements, but I'll just tell you that that's what I wrote about. What should my main focus be as a primary, and how was the interview? Right. So this is something I have to say that when I was applying for the program, I was a little bit intimidated by Dr. Marie and Prof. Oscar and stuff. But like when you are in the interview, they're actually very friendly, and it's more of an informal chat, I would say. So don't get your mind boggled. Like don't strap yourself down. Like overthink the interview and stuff like that. They just want to get to know you, and as long as you have all the prerequisites, you should be fine. And just prepare for it's like simple questions like why you want to do surgery and stuff like that. And will the exams in the program be hard? Okay, so with regards to this, it really depends on the type of student you are. So, for example, for me, I coming out straight out of undergrad. So my biggest difficulty was in the technical aspect of the program, the technical skills aspect, because I never had done suturing and stuff like that before. So I needed to put extra focus on that. Whereas for certain other students that were in the field for a certain amount of time, that was much easier to them. But the clinical knowledge aspect was something they had to brush up on, because it's been a long time since they've left medical school. But what I will say is that the faculty of the program will 100% help you out. Like if you're struggling with any particular field, they'll give you extra attention, and they will make sure you pass it in the resits and stuff like that. Like, yes, students have failed in the first run of the program, but you will be, you will be trained to come up to the mark when it comes to the assessment and stuff like that. Yeah.
I presume there's some sort of remediation and then a
Yeah.
repeat exam and things like that, right? Okay.
Yeah.
All
There
right.
is. Yeah.
Okay, thank you for that. Now, so that's good. Now, again, Prinpreet, another question for you. What is it like to be a student? I think you've already, this is coming through the email, but I think you've already talked a lot about what it's like to be a student there in Dublin, in the course, as well as outside of the course with your extracurricular, your activities. But have you made any friends is the other question that that has popped up.
Yeah, I would say I've made a lot of friends, not just from my course. I'm close to a lot of the kids who are living at my student accommodation as well. I've made a lot of friends through in the undergrad program, the RCSI program, through because I'm in the kickboxing club in RCSI. You make a lot of friends through the travel club and stuff like that as well, and as a postgraduate students unit. So um, I mean, making friends it's completely your prerogative as well. But like people here are generally very friendly and very easy to get along with, so that shouldn't be a problem. And you should be able to have like a lot of good experiences while you're here for sure. Yeah, but like most things for the program, you get what you put into it. So it's completely up to you, like what your focus is going to be on. So
Yeah, that's a good answer. I guess it depends on your personality, but by and large, I think you will make contacts and friends that you'll remember for a long time. I would think. Yeah. Okay. Well, thank you. Another one, I think, for you, Pranpreet, do you feel you've been equipped with skills and competencies that will benefit you in the future in a career in surgery? So, in other words, you start off your surgical career, maybe you'll start off with your foundation year or whatever, and do you think this is going to help you?
I would say very much so. Like when I finished the undergrad program, I finished with pretty reasonable results, I would say. Like I was quite confident in my skills as well. But when I joined this program, like it really changed my perspective, and like it took my skill set to assimilate it into a working setting. So that is not something you're going to have like going straight into internship. Like I feel to some degree a program like this is actually quite mandatory for students that are coming out of medical school, because I can't imagine going from medical school to foundation year and not having a transition period in between to equip me for that time. So I think in that aspect, like the skills, like from communication skills, building my core knowledge, as well as the surgical skills, like I've definitely been very well equipped, especially now. Like I feel very confident in my ability, like over the course of the program. So
Great. Thanks, Pranpreet. And how hands-on was this course? I think you've already talked to us about how hands-on it is. Do you want to very quickly supplement that?
yeah, I would say there are no didactic lectures in this course. It's completely interactive. You're most of the time you're spending 8 hours a week a minimum in the lab, right? And you're always hands-on with the patients in the morning as well. I would say about 70 to 80% of the course is practical, hands-on, and the other
Right.
20% is an interactive kind of setting. So
Excellent. Okay, and I think there's another question here on the weekly structure of the course. I think, Dr. Morris, you've already shown a timetable, a schedule for the week, a very busy, a packed week. So I think that's already been answered. Unless you want to add to that, um, and would a certificate of participation be issued at the end of the practicals? Maybe perhaps at the end of the course, might be what that might mean. Dr. Morris.
Well, yeah, I mean, we teach the competency. So everything you do is you're taught and assessed either, as Prim has said, on the first sitting, or else, students pass on the supplemental because of remedial teaching. So, absolutely, like individual certificates could be given for discrete skills, but like you're competent in all of the competencies required from, a surgical trainee, and according to the General Medical Council's professional capabilities as well. So absolutely, I mean, you will be competent, not just, it's not attendance related, it's measurable competence that you will have proof of at the end.
Fantastic. Thank you very much. Now this is a question that's asked quite frequently, isn't it? Would studying this in this program allow us to apply for internship in Ireland?
Yeah, I mean, it doesn't in any way accelerate. It's an independent process. So you'd still have to meet the Irish Medical Council's criteria for internship, independent of the MSSP. So it wouldn't be instead of. You'd still have to, like, the core surgical training and the Irish Medical Council registration. They're independent processes. So you'd still have to perhaps do a press exam or do another entrance exam for the Irish Medical Council separate to the MSSP.
Okay, that's very useful. Well, I guess there are. I think that's more or less what we have for the moment. I'm just looking at the questions that have come in. Um, and there's one question on being in year 4 and I expect to graduate around August, September next year. Can I apply for the program now? So
So you
they're going
have
to graduate next year, and the student wants to know, can they apply for the program now?
Well, no, you need your medical degree, or almost. Like we worked with the pandemic, obviously some students, I think like Prim, some of the final year exams were delayed. So like we worked with Prim and, accepted him onto the program pending the exam and his results, because we knew obviously he'd done so well that he'd passed the final year. So not year 4. No, wait until year 5. Wait until you're in your final medical year and apply. But if you haven't set your exam before the time, you can still apply in your final year, and you can join slightly later, and then we'd work with you to catch up. but you need to be at the end of your medical training.
Perfect. Thank you very much. I think that's all we have time for. If you have any other questions, please do write in, email the program office. I'm sure they will reply to you. But I think we've managed to get most of the questions, Dr. Morris and Pinpreet. Thank you very much for that. So is there anything else, or can we just say a big thank you to everybody who's participated? And I can tell you one thing, I spent a long time in Ireland training. And the friends that I've made, it's very different working in Ireland and training in Ireland. And the friends that I've made and the contacts, I still maintain contacts with my friends and my colleagues at RCSI and in Ireland. And it's just a fantastic atmosphere for teaching and learning purposes. And I would recommend, and this is one of the finest programs you can get if you're seriously thinking about going into surgery. So highly recommended, and wherever you're going to practice in the world, I think. And with that, I think I'd like to say thank you for everybody for taking your time to join us this evening. It's been a fantastic evening, lots of information. Do write in, do ask the questions, and I'm sure the office will be happy to reply as soon as possible. So once again, thank you so much for your presentation, Dr. Morris, and Primpreet, for your participation as well. It's always good to see you. Thank you. Unless anyone else wants to say anything.
Just that there is an Instagram account, so if anybody's interested and they want to follow it on Instagram, the students do like a day in the life, and they record all the classes and show examples of what's happening. So if you want like live reports on what we're actually doing each day, that would be the place to get it.
Fantastic. Thank you very much. Appreciate it.
Thank you.
Anything else? Tevin, is there anything else that we need to add to the agenda?
No, I think that's it, Prof. Thank you all for joining the event. As I said, second round interviews have now begun for the program for 2022 intake. So we advise all candidates who are thinking about applying to kind of get your application in sooner or later, so we can review and kind of interview. But no, it's been a fantastic event, and as you say, this is the future surgical education through simulation. So we advise to kind of get your applications in, But thanks to all, Dr. Marie Morris and Dr. Prem Man, and also Professor Ragu as well, for your help. But definitely, if you have any questions, just contact us on surgerymarketing@rcsi.ie or mssp@rcsi.ie, and we'll surely be able to get back to you.
Great, fantastic. Thank you, guys. Thank you very much. We'll be in touch.
Thank you all.
All right, thank you, everyone.
Thank you.
Thank you.
Bye-bye.